schools being closed down as a result of the coronavirus. And parents are naturally concerned about their kids and how to protect them. It's also worth asking, how do you explain the epidemic to children? Pediatrician Dr. Rosen Crosby with LA Pure Pediatrics is here to talk about some of those issues. And you and I were talking before about the impact on children, especially the emotional impact. And sometimes we parents shouldn't talk about some things in front of them that could cause anxiety. Yes. How does that relate to the coronavirus?
Well, I think that we have something new that we're dealing with. There's a lot of unknown about it still. And when you hear the news or you watch the news, you see people that look like they're, in hazmat suits and the scary images that are on there. So I think that parents it's going to make them feel more anxious because if we don't know what to expect, schools are closing, how bad is this? Those are the questions we're getting. Parents need to really take time to take some deep breaths and calm down about it before they are talking with their children, and careful what they say in front of their children.
What should they say to their kids?
So I think for kids, it's good. First, they need to make sure they're not talking to each other about it. Oh my gosh, someone just died in LA today. I think that shouldn't happen. I think they should say to the kids, okay, what have you heard? What do you know? Because kids often hear stuff that isn't true, and they may have their own version of it.
I think one of the things that's really interesting about this virus, and we talked about it earlier, we're watching this in real time. This is one of the first examples that I can remember in my life where we're watching a virus unfold in front of our eyes in real time, and one day you got this many cases, and this day you got a few more, and the next day, and you start to realize the growth of this thing and the impact. But the impact still is not big on the young kids, and why is that?
Right. So we think there may be a few reasons. So coronaviruses are a family of viruses that are not new. So there's a couple types. One type causes upper respiratory tract illness, so more like runny nose, cough, mild disease, and kids get that all the time. We send viral panels on nose swabs on kids during cold and flu season especially, and they'll come back coronavirus, HK, and different ones. So they get them a lot. So maybe that has given them some immunity toward this other type of coronavirus, maybe. Like MERS, SARS, and this one are all in the same family, so they do have more of a propensity for lower respiratory tract infections and disease, but maybe this is helping them and we don't know. Or is it because kids just generally just don't get sick from it and we don't know why? Like chickenpox is worse in adults than in kids. EBV, infectious mononucleosis, under age 5, they may not get sick or get a cold, but those teenage patients I see that are very sick, and adults can get very sick.
But for the adults, that respiratory area right there, that can lead to pneummonia. That would kill you. That would kill you.
That could. Or what they call ARDS, so that's acute respiratory distress syndrome, and that is inflammation in your lungs, and then a potential for sepsis. You can get overwhelming bacterial infections.
I want to get a little bit of a backstory from you. You talk to parents all the time. Tell me a little bit about what they tell you.
That's a good question. So on Sunday, I was on call for a practice, and I sat and just answered calls for hours straight about this. People who would even call and say, I normally wouldn't call you about this, but with what's going on. That's the lead-in that I've been hearing from most families.
And this is nonstop phone call.
And my child has a runny nose, or he just spiked 102 fever. And normally I would just treat it and do what you guys always tell me to do. But what do I do in this case? Does it change? So right now we're giving them the typical advice we always do during cold and flu season about how to treat those. We don't have widespread coronavirus around here right now. It's not running rampant like you might feel it is when you watch the news. So that's important. And also that 80% plus have mild illness and recover is also important too. And that, it's not something that is going to be devastating like it might look.
So again, let's try to separate fact from fear.
Yes.
We heard earlier in the show a parent who was afraid to take her 14-month-old to art class at the local recreation center because her immune system is fragile, maybe as a young toddler. Is that a worry that parents should have? And the other thing is, because the elderly can be horribly affected by this, should we not have our kids visit the grandparents?
That's a good question. So that's also evolving. As far as kids going around other kids, since kids tend to get mild disease, we're not just saying no. If the health department says no more baby classes, or like we're up in the Bay Area where they're limiting crowd gatherings of 1,000 or more. So that's why it's good to check the health department site and watch what's happening, because it's changing every day. But we're not saying, oh, your 14-month-old is immunosuppressed. If they are immunosuppressed and they're on steroids and they have medical condition, probably probably not a good idea, but we would say that about the flu too. So I don't think it's going to change that.
Doctor, what are you telling the parents of your patients?
So most of them were saying, treat it. This is what you do. Stay home if you're sick. If you have contact with someone, then of course you're going to let us know. I think it's better to call before you come in, because a lot of people want to come in and get tested, and we don't have access to testing easily right now.
In a lot of cases, they don't want you don't want people to come into your
right,
office.
Exactly. So we're saying it's better to call first, because, and even hospitals are saying, don't just run in here for everything. Call your doctor if you were exposed. If the health department contacted you, it's going to be very different.
Right.
So we have to be extra careful.
Right.
But I think, in general, with talking to kids, also turning off some of the media and the TV and not having this running in the background with the scary images.
There's a lot of exposure of information.
It's a lot.
All right, well,
yeah.
thank you very, very much. We'll be back.